All right, how you doing?
I'm good.
My name is Dr. Will, and can you please tell me why are you here today?
Um, Basically, I have anxiety and depression. I kind of battle with it here and there. I have mood swings where I'm really happy, and then other days I don't want to get out of bed. I don't want to go to work. I don't want to go to school. I don't want to do anything. And I know that that's kind of affecting my life and my friendships. I have family issues with that because I just kind of stand off to myself and I don't want to be around anyone.
Let me ask you, can you tell me a little more about your childhood, like from the events that led to your anxiety?
Yeah, I grew up, I was raised by my grandparents. Um, my parents were into drugs, and so as far as I can remember back, I believe I was like 1 year old when my grandparents took me in to raise me. So I think that plays a big part in it because I don't really have a good relationship with my parents. So I kind of feel like everyone around me's not going to stay around, and it scares me.
Okay. Now, do you? I'm gonna try something a little different.
Okay.
I have never done this with my patients before. Okay, I'm gonna ask you a couple of questions
Okay.
and see what I would recommend for you to better yourself.
Okay.
Okay?
Yeah, I do
Now,
that.
I hope you do like this.
Okay.
Okay? How often do you get to meet up with your friends?
Maybe once every 2 weeks because I'm in school full time. I work full time. So I try to squeeze them in here and there, but with their schedule and mine, it's kind of all over the place. So.
Okay. Now, next, do you really talk about your problems when you meet with your friends?
I open up about some stuff, but a lot of the time I keep things to myself. And that's with anyone. I kind of put on a mask. I feel like a lot of people do that because I don't want anyone to know when I'm feeling down. I want everyone to think I'm okay.
Okay. Now, how are you sleeping these days?
Oh, that's a question. Some nights I can go straight home from work, I'm tired, and I'll fall right out. Other nights I'm up till 7 in the morning, and then I have to get up early for work and school, so that really affects that. I wake up and sometimes I'm just feeling sick, my eyes hurt because I've been up all night and couldn't fall asleep.
Okay. Now, do you diet?
I don't.
Okay.
I was exercising at one point, and I felt like that was helping me, but I always quit.
Okay. Now, how much exercise are you getting?
Now, honestly, I haven't really been working out, so probably the only exercise I'm getting is like walking on campus, and I sit all day at work, so that's probably about it. Sometimes I go to the park and walk. It's not that often, though.
Okay. Now, is there anyone who you feel really understands what you're going through? Like close to you, basically.
No, I feel alone most of the time. Like I have friends and I have my family, and I know that if something really bad happened, I could go to them. But most of the time, I just feel like no one understands what I'm going through. I'm kind of living on this world alone.
Okay. What choice do you have about what happens in your life?
Um, I kind of feel like things are kind of just thrown at you and it's life. I mean, you can choose to make better decisions. I guess that's kind of why I'm here because I want to better myself. I realize that I have this and I need something that's going to help me fix this or I guess give me some progress with life.
Progress. Okay. Follow-up question. Is there anything else would you like to include what I just asked you?
I think that's about it. I feel like you touched kind of every area, like exercise and work and why I'm stressing, who I can talk to. So,
Okay. Do you have a clear sense of where you want to take things in life?
no, I don't. That's another thing. Sometimes I'm scared. Like I feel like I'm here, but I don't really know my purpose. Like there's something else out there that's missing, I guess.
Okay. All right. Do you feel excited by anything in your life?
Well, I have pets. They keep me company. They make me happy. I feel like they're always there when I'm sad. Um, like I said, I don't really have my parents around. I have a few siblings. We meet up sometimes and we don't talk about everything. I don't like to tell them everything because I feel like they'll judge me, but I guess them being there is kind of the support I need to let me know I'm not alone, even though I feel that way sometimes.
Okay. Now, final question. What involvement do you have with people around you?
I feel like it's just the bare minimum. Like with school, I talk to my classmates. Just dealing with school, I don't really have any friends there, and then with family, they're always busy most of the time. So, like I said, most of the time I feel like I'm just alone.
Okay. Well, I had to go through the same thing, but then I woke up and changed my whole lifestyle around. So I understand what you're going through.
How did you do it?
Well, well, there's a lot of things I recommended for myself. Now I'm gonna recommend a couple of things for you.
Okay.
But I must tell you, there were no antidepressants was involved. That's the last thing I'm gonna do for you. No medications or anything.
Okay.
So we're gonna try a couple of things and let's see if you agree to them.
Okay.
Now, I understand that you don't get around much a lot. So I'm gonna give you this card.
Okay.
She happens to be the best therapist of interpersonal therapy. I recommend this.
Okay.
Okay? I want you to write a daily journal. Now,
I'm gonna write these things down
okay,
so I won't
yes,
forget them. If that's
please.
okay.
Please. Now, if you have not done exercise, I really encourage you to exercise and continue exercising. At the end of the day, you'll feel better about yourself. And that's how I felt when I exercised. At first, I did not want to do it, but at the end, I felt better in myself. I felt more positive. I felt that I wanted to do more things. So I continued on doing. Then you'll look good about yourself. You can be honest with yourself. And other people as well. You can help other people.
So you can build some friendships.
Yes,
That's how I don't have
exactly.
anyone.
Okay. Now, I understand that if you're not on a diet, but I encourage you to get on a diet.
Okay.
No salt, no sugar.
Okay.
Now, you're probably going to say, oh, Dr. Will, I want some sugar. Please believe me. Just stick to sugarless candies, diet, fruits, vegetables, water. Stay away from the dark sodas.
I
Okay.
love drinking Coke.
Now, well, that's done. That's done. I don't question. Establish regular sleep and wake times. Create a proper environment for yourself. You can encourage other people. Okay. Now, avoid drinking alcohol. If you're drinking alcohol, stop that. Avoid no more.
That just makes me feel down in the end, but...
Continue therapy sessions with me. I want you coming back and forth so we can just behave, act more differently this way. I also strongly recommend go to massages, go to the spa. You can feel good. I recommend that. Okay, now, I also want you to do behavior therapy.
Okay. What's that?
Behavior therapy is letting people know how you feel every day. Feel at night. You can meet people, make friends from there.
Okay.
You can either go back to college. Do the best you can.
Okay.
But the last thing I want you to do is antidepressants.
Okay.
And I know that I'm a busy man, but a busy doctor, but we are going to stop for today.
Okay.
And come back and see me.
Okay.
Okay?
Thank you.
All right.